Ebola Explained. I'm Dr. Frita, and today I'm giving you 5 facts about Ebola you should know in just one video. Ever since Ebola resurfaced in the 2026 outbreak, there have been many concerns about the new cases, how it spreads, how can it be contained, and will it be the next pandemic? I started covering the Ebola 2026 outbreak on day 1 with my short form videos. And many of you who have been watching have asked me to do a deeper dive. Well, today, here it is. We're going to get into even more detail when it comes to Ebola. And let me explain. I actually have a unique perspective. I am a medical doctor. I'm a physician who has been quadruple board certified. I'm a board certified nephrologist, meaning I'm a kidney doctor and a high blood pressure doctor, which gives me a rare view on how Ebola affects organs, specifically the kidneys. I am also board certified in internal medicine. I am a board certified obesity medicine doctor. And after I completed my dual internal medicine pediatrics residency at the Georgetown University Hospital School of Medicine, I earned my board certification in pediatrics. So I am not new to breaking down diseases. And today you'll see that firsthand. We'll go over these 5 facts: what Ebola is, what Ebola does to your body if you get it. We'll talk about why the death rate is so high. I'll share with you how Ebola spreads. And very importantly, I'll answer the question, will Ebola become the next pandemic? The purpose of this video is not to scare you. I definitely don't want to cause panic. What I do want to do is make sure that you have a proper understanding of Ebola so that you'll be able to make the best decisions for yourself and for your family. For those of you who have already been watching my multiple videos I've done on Ebola, you'll already have some context. And today, we're taking an even deeper dive. This is Ebola Explained. I'm giving you 5 facts about Ebola you need to know in this one video. Keep watching. Listen, I love talking to you and us having these conversations through my videos, but you know what else I love? Talking to you one-on-one. So if you would like to have a consultation with me one-on-one, I do provide a telehealth concierge service, and I can talk to you from anywhere in the world. We have a conversation, a video call. I do a full history. I give you a first opinion. I give you a second opinion, and we can talk about kidney disease. But remember, yes, I'm a board certified nephrologist, but I've also been board certified in internal medicine, pediatrics, and obesity medicine. And so there's a whole lot of subjects that we can cover, and we can cover them one-on-one from anywhere in the world. It doesn't matter. So please, if you're interested, click the link in my description and let's have a telehealth concierge appointment. Please be sure to like this video and subscribe to the channel if you have not done so already, because I'm about to give you some evidence-based medical information on Ebola. Let's jump right on in. What exactly is Ebola? Well, the Ebola virus disease is an infection caused by the Ebola virus. And the Ebola viruses belong to the family Filoviridae. There are 6 species of Ebola. Only 4 are known to infect humans. The ones that affect humans include the Zaire, Sudan, Typhorus, and the Bundibugyo strain. The Zaire strain is quite deadly, and that's the one that people are most familiar with. Ebola was first discovered in 1976 near the Ebola River, for which it got its name, now known as the Democratic Republic of Congo. The virus is believed to have originated in animals, specifically the fruit bats, although science has not 100% confirmed that fact. It is believed that originally the Ebola virus jumped from animals to humans. It's a zoonotic infection. And people who hunted and ate certain animals, like fruit bats, are believed to have been at the highest risk. Once in humans, the infections can turn into outbreaks and epidemics that can be quite deadly. So yes, Ebola was first discovered in 1976, and then there have been multiple outbreaks since then. The most deadly one to date was the one from 2014 to 2016. That one was in West Africa, and it caused at least 11,000 deaths. We even had cases in the United States from that 2014 outbreak. 2026 marked the 17th Ebola outbreak in the Democratic Republic of Congo, DRC. So you see, Ebola is not a new virus. It's one that keeps coming back, but it can be contained. It's possible. Think of it like a brush fire. When a brush fire occurs in the right conditions, where there's dry land and no burials, it burns hot and it spreads quickly. But if you contain it, then it can be controlled. Same thing with Ebola. That's why rapid response is so critical to the management of Ebola outbreaks. I've mentioned some issues with the 2026 Ebola outbreak in some of my previous videos, specifically the change in the United States response with our dismantling of USAID and our withdrawal from the World Health Organization. Question: on a scale of 1 to 10, how worried are you that Ebola will reach the United States in a significant way? 10 is extremely worried, 1, not worried at all. Please be honest. I really want to see where your head is. What happens to your body when you get Ebola? Symptoms and progression. Once you are exposed to Ebola, the incubation period is anywhere from 2 to 21 days, though most people will show symptoms after 8 to 10 days. During the time that Ebola is incubating, when you haven't shown symptoms yet, you are not contagious. Again, you are not contagious with Ebola if you have no symptoms. In the early phases of the disease, you get what we call dry symptoms, and then as it progresses, you get wet symptoms. So let me just walk you through it. In the early days, days 1 to 5, you will present with symptoms like a fever, a severe headache, body aches, sore throat. This early stage looks almost identical to symptoms of diseases like the flu or malaria, which is why early diagnosis is quite difficult when Ebola occurs in regions where these other illnesses like malaria occur. During the middle stage, days 5 to 7, is when the wet symptoms begin. You start getting vomiting, diarrhea, a rash, and you start showing signs that the liver and the kidneys are compromised. Lab tests will reveal that you have elevated liver enzymes, the white blood cells start dropping, and the creatinine will start to go up. As Ebola progresses to the late stage, blood vessels become damaged enough to cause internal and sometimes external bleeding. This is where the term hemorrhagic fever comes from. But remember, every patient with Ebola does not develop visible bleeding. This is a late stage complication that not every patient experiences. Ebola can attack the kidneys. And remember, I am a board certified kidney doctor. Once Ebola starts to affect the kidneys, it interferes with their ability to filter out waste, to have fluid balance, to make sure that your electrolytes are balanced. And once the kidneys are affected severely and the kidneys fail, well, then you get an extreme buildup of toxins and waste in the body. And this contributes to the multi-organ failure that is seen with so many Ebola cases. According to the World Health Organization, there is an average case fatality rate of 50%, and that rate ranges anywhere from 25% to 90%, depending on the care. So if you are living in a place with excellent health care, you have a greater chance of having a good survival. But imagine if you're living in a region, like some of the regions in Central Africa, where there is really no health care, then the case fatality rate can be as high as 90%. Imagine that, getting Ebola and knowing that 9 out of 10 people will pass away. That's real. And again, that's why it's so important that for those of us who live in high income countries, we must share our resources and our aid in order to help to reduce the case fatality in countries that don't have that privilege. Why is the death rate for Ebola so high? This question gets searched so frequently, and so I'm about to break it down. I'm going to give you 5 reasons why the death rate is so high. We know that the mortality rate ranges anywhere from 25% to up to 90%, and that largely depends on access to care and how early the Ebola symptoms are caught. So here's why the death rate can be so high. Reason number 1, Ebola attacks multiple organs at the same time. It's not just one. Ebola attacks the immune system, the vascular system, the liver, the kidneys. And so your body is trying to fight this infection on multiple fronts. Reason 2, limited treatment options. There's still no antiviral, no treatment that covers all of the different strains of Ebola. So largely the treatment is supportive, meaning giving IV fluids, electrolyte replacement, transfusions when necessary, oxygen. And if you are in an area that does not have proper health care or even ways where people can properly wash their hands, then that limits the treatment even more. Reason 3, where outbreaks occur. Many of the outbreaks occur in rural, underserved areas where there is very limited access to healthcare, limited access to running water, limited access to healthcare professionals. So if you get Ebola in a location with poor treatment, then yes, the death rate will be high. Reason 4, the immune system overreacts. In many cases of Ebola, the body's immune system will create a cytokine storm, and this is when the immune system starts doing damage to your organs, even beyond what the virus is doing. Now, this is not unique to Ebola, but in cases where the immune system overreacts and causes your organs to fail, when you get septic shock, then this can certainly increase the rate of death. Reason 5, late diagnosis. Because early symptoms of Ebola are very similar to symptoms of the flu, symptoms of malaria, people are often not tested early enough and not isolated early enough. This increases the rate of the outbreak growing and, of course, can lead to more death. I will say that during the 2018 to 2020 outbreak, the survival rate was as high as 63% in places where experimental treatments and better healthcare were available. So we are making progress, but healthcare access is key. How Ebola spreads and how it does not. Ebola is a virus that spreads by close contact with bodily fluids. It is not airborne. It's not something that you can catch if someone sneezes and it's aerosolized in the air. It doesn't spread the same way that the flu spreads. It does not spread the same way that COVID spreads. You must have close contact with bodily fluids because the Ebola virus does live in body fluids such as blood, urine, vaginal fluids, semen, breast milk. And so the people who are at highest risk are people who are caregivers of patients with Ebola, healthcare providers, family members who are very deeply intertwined. You can also get Ebola from objects or fomites. And so if the bodily fluids of someone with Ebola have touched clothing, bedding, a table even, and you come into contact with those objects, you still can get Ebola. This is why you are advised not to touch the clothing or the bed sheets of someone with Ebola. Another way you can get Ebola, and this is very important, is from deceased bodies. And this is significant because in many communities in the DRC, Democratic Republic of Congo, where there have been many Ebola outbreaks, part of the ritual of burying somebody with Ebola is to wash the deceased body or to touch the deceased body. And deceased bodies of patients with Ebola are still contagious. So yes, you can get Ebola if you touch someone who has already passed away. This very much complicates the containment of Ebola because many people feel offended or frustrated when healthcare providers come in and tell them not to carry on their routine traditions of touching a deceased body. But not touching that body is key in order to contain Ebola and stop it from spreading. Now, how can you not get Ebola? You cannot get Ebola from casual contact, from just being a traveler or a passerby, or from walking into a room and breathing in aerosolized particles. That's not how it's spread. Again, it's close contact with bodily fluids. Here's another way to assess your risk. If you, for example, live in the United States, unless you are the healthcare provider for someone with Ebola or in very close contact where you're sharing bodily fluids, then your risk of getting Ebola are exceedingly low. Oh, and this is a very important fact about how Ebola spreads. You can only get Ebola from someone who is symptomatic. And this is a big difference between Ebola and COVID. With COVID, patients who have no symptoms can be contagious and not even know it. But with Ebola, unless a person has already started to exhibit symptoms, they are not contagious. Question: did it surprise you that Ebola is not airborne and that you can only catch it from someone who is already symptomatic? Can Ebola become the next pandemic? This is a question that's really on just about everyone's mind. And the answer is not likely. Ebola is not likely to become the next pandemic for two reasons. One, the way that it spreads. It's not airborne like COVID is, and so it does not spread as easily. And the other reason is that you can only be contagious with Ebola if you are already symptomatic. And this also differs from COVID, where you can be walking around feeling perfectly fine and just spreading COVID left and right. And so it's different in that aspect. Also, when it comes to Ebola, at least for the Zaire strain, we have an FDA-approved vaccine. We have FDA-approved antivirals. And even with the Bundibugyo strain, we are rapidly working to develop vaccines. Also, our responsiveness is quite different than it used to be. We have contact tracing. We have the World Health Organization, which spreads information globally to increase our ability to contain the infection. Even still, with all of these aspects that make Ebola unlikely to become the next pandemic, I would be dishonest if I said that it is an impossibility for it to become a pandemic. Because, of course, Ebola does have animal reservoirs. We believe that it is in fruit bats and other animals. And as long as we have people who hunt and eat these animals, then Ebola will likely always jump from animals to humans, and then, of course, from human to human. And we know in this world, we have really just great travel. You can be from on one side of the world and travel over several continents to the other side of the world in just a matter of hours. And you can do that while infected with Ebola before you even have any symptoms, and you can get to the next place and then become contagious. We saw that in 2014 when the young man from Liberia was infected with Ebola, traveled to Texas, where he then developed symptoms, and he got 2 nurses who were taking care of him sick. So we know that it can spread. But again, the likelihood of it becoming a global pandemic, not likely. Science is ever evolving, still always a possibility. A huge key is education, which is why you're here right now. The more people who know about Ebola, who understand how it spreads, who know how to protect themselves and their loved ones, who recognize when it's appropriate to accept vaccines, well, the more people who are informed, that can also help to decrease the chances of Ebola becoming a pandemic. Admittedly, the subject of Ebola can be a bit overwhelming, a bit scary, but let's just break it down because we are not at a loss. We do have certain preventions and certain treatments. One, we have supportive treatment, which includes IV fluids, supplemental oxygen, electrolyte replacements, things of the like. And then we do have a vaccine, at least for the Zaire strain. No, we don't have one for the Bundibugyo as of now, but we have that FDA-approved vaccine for the Zaire strain. And once you find out where outbreaks are, if you vaccinate high-risk populations, that really can contain the virus and help to decrease the spread. And then, at least for the Zaire variant, we do have 2 FDA-approved treatments. We have monoclonal antibody treatment. We have Asuvimab and Inmazeb. And organizations and coalitions are working rapidly to create vaccines and treatments for the other strains of Ebola that affect humans. We also do have some effective prevention strategies, such as maintaining distance from people who have Ebola, making sure that you have proper hand washing techniques, proper personal protective equipment when around patients with Ebola. I mean, think about it. 10 years ago, we didn't even have a vaccine or some of the treatments we have today. Now we have more advanced contact tracing and ways to get information about education out to the global community. So I do believe that there is a great chance that survival rates will continue to improve as far as Ebola is concerned. Today, I gave you 5 facts about Ebola. We packed in a lot in just one video. You now know exactly what Ebola is, what it does to your body, why the death rate is so high, how it spreads and how it does not spread. And we've talked about whether or not it is likely to become a pandemic. If you found value in this video, please give it a like and share it with the people you know need to hear this information. Also, if you have not done so already, be sure to subscribe to this channel at dr.frita. I give you consistent, evidence-based medical information, and I give it to you in a way that's easy to understand and to share. As always, I appreciate you for your support, and I want you to do your best to live your healthiest, happiest life. I'm Dr. Frita.